So what I'm doing now from the centre is starting to prepare a 5-year service, workforce and financial strategic framework. But what I'm absolutely clear in my mind is that the 1,000 Lives campaign will be one of the threads of that work.
The 1,000 Lives campaign is just so exciting. It's an entire nation being mobilized. Everyone's in. This "Count Me In," a theme for the last 6 months, is exactly right. It's an invitation for everyone to help in improving care.
We've heard today about the 5-year plan, and I think that's a good framework to think about sustainability in that longer term past next April.
There's been a lot of engagement by clinicians and frontline staff because this is really, the safety and quality agenda is really what they come into the NHS and practice healthcare for, and it's the science behind it that really makes it intriguing for clinicians.
There's been so much buying from clinical staff, from the workforce, because they feel that they can engage in a project that actually they can see material changes, material advances.
Well, I think we can improve safety just by listening to patients. As I said, patients are just people who happen to have an experience. More often than not, from the ones I've met, it's good, but there are instances where things have not gone perhaps as they might have hoped or expected, and just listen.
We have taken a particular approach in Scotland. Wales has taken it as a campaign, almost as a social movement in some ways, and it's interesting to see the contrast, but also the similarities, and the similarities are an absolute commitment to measurement and to being explicit about what they are determined to achieve by a certain time.
All too often, board agendas are about things like the trust's financial position or the health board's financial position, and you can actually lose sight of the patient in an otherwise busy agenda, and there is really, in the end, no excuse for that. The patient has got to be at the heart of the agenda.
I think if we pay attention to quality and safety and make sure our practice is in those regards efficient and effective, that we'll also be providing care that makes best use of resources.
We want the campaign to grow, to develop further, and we're just at this point where we need to, on the one hand, celebrate the success, on the other hand, see how we can drive this forward, extend it so it reaches all across the NHS in Wales.
There's no doubt that we face challenging times as we look ahead in the National Health Service in Wales, and what's going to be important, I think, is that this agenda around patient safety, this agenda around healthcare improvement is not the first thing that falls off the agenda when times get tight.
Tomorrow morning somebody's still going to need their operation and they want that to be provided safely. Next Tuesday somebody's still going to be in a GP practice expecting to see their GP practitioner. So I think the emphasis of the campaign is really to keep a focus on what's really important to all of us.